Welcome to Washington in Focus. I'm Carlene Johnson, along with our investigative reporter, TJ Martinell, who has posted this week another article in his series, sort of taking a really deep dive into the Washington state budget and the massive expansion in spending, and some agencies a bigger chunk of that than others. And an article posted Monday indicates that the Washington State Department of Social and Health Services spending since 2015, just in the last 10 years, has nearly tripled. And there is one kind of main driver in that explosion of taxpayer dollars. So TJ, break it down for us.
Yeah, so the spending has on long-term care has grown from $3.8 to $12.9 billion, and it now represents half of the agency's biennial budget. And what's going on is that the population of the state is getting older. So there's more people on long-term care. There's more burdens on the system. So the state's just subsequently spending more money on that. Now, DSHS only covers long-term Medicaid. So their spending as part of Medicaid is for long-term care. It doesn't cover other types of Medicaid. So that's pretty much what's going on. And I'm guessing also, they've got the caseloads that have increased significantly for a lot of the people. And if the cost for caring for each of those individuals goes up, then it has a, kind of a tidal wave effect. And it adds to the reasons for the state spending increases in this area.
Wow. But that's massive expansion. How much of it is just because, you put somebody in, a family member has to go into an assisted living facility or whatever, what the state portion of that's paying for that care. Maybe they live a lot longer than they used to.
Yeah, that's another thing that's interesting is that when people live longer, they are taking they are remaining an expenditure for the state. And this is just one area. For example, if somebody retires at 65 and they are 100 years old, they've been on Social Security for 35 years. So as opposed to somebody who dies 10, 15 years later, obviously it's nice that they live to be 100. But at the same time, that means more years that other people are going to have to spend money through the state to care for them. And so it was interesting. I found that there was areas where the budget has also increased. There's developmental disabilities that increased. But what was interesting is that actually the public mental health spending has actually gone down. It was $2.3 billion in the 2015 supplemental budget. And then this current biennium is just $1.7 billion. So, and that's not adjusted for inflation. So not only has it gone down, on face value, it's also gone down if you adjust for inflation as well. So it's an interesting thing to see that not all areas of the budgets are getting an increase.
And more people in, these long-term care facilities, they're on the taxpayer dime versus, now we're required, right, to have long-term care payroll deduction. That's going to be a whole different basket. But I'm thinking of, family members of my own that have been in assisted living facilities, and, this much is covered by, their own savings or whatever plan that they had paid into. And then the state and federal portion kicks in because of their age. It's odd to me. Like, do we have more people that are simply dependent on taxpayers in those facilities, or is it just the costs have gone up greatly too?
The number of eligible Medicaid clients who receive care in state licensed nursing facilities actually went down from 10,000 to 7,500. So that's an interesting thing. But other areas where you have like developmental disabilities, and this is a program under Medicaid, that increased from 15,000 to 17,500. And the time period for that is since January 2017. So this is not a 10-year period like with the spending, but this is the timeline in comparison that the Forecast Council uses. So it has shown increases in stuff, but I think what we'd also have to look at is what the costs are for those services and how much they've increased since, 2017. And I have a feeling that amount has increased. But yeah, it's like you're saying, there's people who are dependent on taxpayers to be supported. And, there's a whole separate issue to deal with Apple Health, which is our state Medicaid program, and the number of people who've joined that since 2015, which is significant. So, this is just more burdens, financial burdens of being put on taxpayers.
Well, and I wonder if in the years to come, as we're all paying now into this, long-term care payroll tax, which, you and I have both written on, isn't really going to be much to go on when the need arises with the lifetime benefit of 36 grand or something like that, which, if you've ever had a family member in a long-term care facility, that's like, a few months or something crazy. But I wonder if that is it. Can't recall if the goal of that for folks that were proponents of that system was to offset the burden on everybody else because they see this explosion in costs. Wonder, will it get any better because we're all paying into it more?
Well, that remains to be seen. But as we know, spending more money on something does not correlate with increased quality or, efficiency or anything like that. It just means more money is being spent.
And what did Elizabeth New at Washington Policy Center tell you? I know you included some of that in your Monday article. What was her kind of insight on this explosion in costs from DSHS?
Well, and it remains to be seen how this is going to deal with the one big beautiful bill's effect on Medicaid. But she was arguing that the problem with Medicaid is that in her opinion, eligibility is really broad. And we're super generous with what we cover as a state. So that could be also what's going on. Now, her comment applied to both Medicaid and long-term Medicaid. So this is, they're a little bit different, but she was just saying that there's a lot that's being covered. And so that's possibly also the other thing that's going on is just you have a very generous program in terms of, what it covers and who it covers.
And you also included, we spent a little chunk of Medicaid change here in the state on folks who are here illegally. What's going on with that?
Yeah, that was a separate story, but there's what's called Apple Health Expansion, and it is a program that they're spending $150 million on in the next biennium, and is for people who are not here legally. So they do not, according to the Washington State Healthcare Authority, they do not need to provide documentation because they don't. Obviously, because they don't have it. So this is a free health care for people who are not in the country or the state legally.
And how much are we spending on that?
That's $150 million. And keep in mind, this is at a time when, one, we've got a fiscal crisis as a state. Two, Washington State has chronically undercompensated Medicaid medical providers. Medicaid patients to the point where a lot of medical providers are no longer accepting new Medicaid patients as a result, because they just can't afford to. They're not being given enough money in compensation for the services that they provide. So instead of using that $150 million to fix that, they're giving it to people who should not be here legally.
Well, yeah. And that part of it that you just hit on about the hit to providers and them no longer accepting Medicaid patients. I don't think there's enough focus on that because, you talk to anybody in healthcare about how significant that is. And then whole entire practices that have closed up completely because, if half your patients are, that's what your reimbursement rate is, and your office visit, is billed $500 and you get reimbursed $350. Well, that math doesn't math very long for a provider, right?
I think that's, this is kind of where it's a little strange because what's the point of having free healthcare for even if people want to argue in favor of free healthcare for illegal immigrants? And these are for ones who qualify because they are making below the federal, a certain percentage below the federal poverty level. What's the point if they can't find a medical provider because nobody wants to accept them? I mean, that's kind of the issue, is where there's no point in having Medicaid insurance for people in Washington State if no one's willing to treat them. I mean, I don't know if I don't know the laws around this, but I'm just wondering, at what point is the state legislature going to legally mandate that a medical provider accept Medicaid patients and make it illegal for them to refuse services? I mean, knowing the legislature, that's probably what they're going to do next. Is they're just going to say that they're discriminating, that it's inequitable or something like that, and then say we're going to legally require you to do this. At which point, many providers may just close shop for good and go to another state where they're going to get compensated better if they treat Medicaid patients, but also where they're given a little bit of autonomy over how they practice medicine.
Yeah. Not a sort of a fair or even a similar analogy, but what you just said there makes me think, like what they're doing with the trucking industry in Washington, right? You must sell a certain number of electric trucks before you can sell any diesel trucks. Otherwise, we're going to penalize you. Yeah, they could do that with doctors. You must accept these certain number of patients that you're going to lose money on before you can take any that you're going to make money on.
Yeah, they could just say you cannot deny services. You can't deny a potential patient who's not because they're on Medicaid.
Just because you're going to lose money, you can't deny him. I mean, the absurdity of that. Yeah. Like you say, many providers have already closed up. You just move across the state lines into Idaho, and it's a lot more friendly there to do business as a medical provider. Wow. Well, this is fascinating. I've loved this whole series that you've been breaking down the budget, TJ. Really, I encourage any listeners to check out the story. The headline of the story is Fiscal Fallout, Long-Term Care Spending Driver of Washington DSHS Swelling Budget. I'd say the swelling to the point of like exploding or something at some point soon. But thank you very much, TJ, for the fascinating article. I'm Carlene Johnson, and this has been Washington in Focus.